Oh, you've got to do an intro.
Yeah. So today we've got an amazing lecture coming from Trish Flood. Trish Flood is a counsellor, psychotherapist, absolute legend, and is also studying her master's degree in mindfulness. Is that right, Trish?
Yes, it is.
Amazing. Take it away, Trish.
Okay, so when I say mindfulness, what do you all think about mindfulness? What's your thoughts on mindfulness? And we'll unwrap it as we go along. Yeah. What? Yeah.
I'd say having the ability to tap into different experiences or different sensory inputs as you wish to, like psychological flexibility.
Anyone else?
So being intentional with your behaviours and thoughts and being able to reflect on and observe.
So who practices mindfulness and who practices meditation? Who's your meditation, aren't you? Do you do mindfulness as well?
Yeah.
So bye. So what we'll do is we'll go through a little bit about psychology of the brain, where mindfulness fits in, research. So research, I mean, mindfulness we know has been around forever. Research in mindfulness probably only been around from about 80s. In the form it is probably only since MRI scans, PET scans, that kind of thing, because they can now see what neural pathways light up, whereas before it was very much they were relying on questionnaires. And because there's quite, in the science world and medical world, there's quite a lot of negativity around things like mindfulness. Until you can actually see what's lighting up in the brain, there's a lot of, oh, it's a placebo, it doesn't really work. So we'll have a look at that. I'll look at placebos, I'll look at some of the myths about mindfulness, where it fits in with psychology, a little bit about the brain, and at the end, a little bit about trauma and when you should be careful with things like mindfulness and not just jumping straight into, I'm joining an 8-week course, because if you're somebody that's dissociating or you're very hypervigilant, then mindfulness, it needs to be something that you can do, but you just need to be aware of what you're doing with it, because it is about being in the present moment and bringing your thoughts to the present moment. And if you're very hypervigilant or you're dissociating, that might not be a good idea unless you're doing it with a therapist or one-to-one in that kind of environment. So first of all, our brains like to play out patterns. So we all repeat patterns from the past, even when they don't work, because our brain doesn't know it didn't work last time. So when I'm faced with a problem, I will go straight into dealing with it in my subconscious the way I dealt with it last time. And the fact it didn't work last time means absolutely nothing to my subconscious, which is why it won't work this time. And all I will do is walk around saying, I don't understand why this always goes wrong for me. And I won't make the connection between my subconscious and my conscious brain. We tend to obsess a lot about past, present and future. We do struggle. Even though mindfulness, they talk about being in the present moment, it's not about obsessing about the present moment. It's about accepting the present moment. But as humans, we like to give everything preference. We very rarely look at life in neutrality. We give preference to everything. We spend a lot of time grasping, pushing away from things, mulling over past conversations, because somehow we think if I go over a conversation I had last week, I can change the outcome. And if it ever happens again, it will happen differently. When of course it will, because it will be in a different time scale, so it will happen differently. Or we worry about the future. We really struggle to actually be in control of our minds. We seek distraction a lot, especially in the modern day world. And in psychology, distraction short term is actually, it's quite positive, because sometimes we do need to distract ourselves because we're not in a position to deal with emotions. But long term, if we're pushing emotions away, thoughts, suppressing them, distracting, then it's not actually a positive thing for us. And in the same way as TikTok, Instagram, our brain works on algorithms. So as we all know, if we're all going on our social media, it shows us everything we've been looking at before, and our brain does exactly the same. So if I'm worrying about a thing and obsessing about it, my brain will continually bring that to me. The reality of life is I actually have thousands and thousands of thoughts just poodling through my brain every day, every minute of the day, And in my subconscious, I am picking out the things to bring to my conscious mind because that's what I've been thinking about. So if I'm in a happy place, I get the good, happy, fluffy cat stuff. If I'm in a bad place, I get all the negative stuff. And we tend to not realise that our brain works in exactly the same way as the social media, which is why we replay things over and over again. And the only way to alter that is by consciously altering that. And that's when it starts to get harder. Oh, my relationship's awful. Your brain is going to go relationships, and it's going to pick up everyone you know that's got a great relationship. It's going to probably on social media, you'll start looking at all accounts that have got everything's going to be everything that you're not. Yeah. And it's just going to reinforce everything that you feel that's negative about you. And because this is all coming from the subconscious part of our brain, we don't even know we're doing it. We're just doing it. And then, that we tend to just, our identity becomes our emotions. I'm always angry when this happens, or I get anxious when that happens. And again, we never ask ourselves, well, why do I get angry when this happens? If I'm surrounded by people who are being aggressive, why do I always react in this way? If I'm around people who are acting in that way, why do I sort of go into myself? We don't ask ourselves those questions. So we then start to just say, well, actually, I'm an angry person, I'm an anxious person. And we also realise, we think that we can't change that I will always have that. And quite often we feel like, well, my mum was anxious, therefore I'm anxious because I inherited it from her. And there's a lot of research out there on what have we inherited and what does it make us more liable to bring on. Hiya.
With mindfulness approach to emotions and behaviour, is it a way of accepting that you are going to observe these things within yourself and not accepting, but also acknowledging that you don't have to necessarily act on those emotions?
Well, what you're looking at is saying, I have a lot of thoughts going through my head every day. They're just thoughts. I'm the one that makes them my thoughts. I'm the one that puts my emotions on them. I put my history, my story, my past. I'm the one who puts that on. And if I leave it alone and just let it flow, it will just go. So I'm the one that's bringing all of that to the table, the positive, the negative, the likes, the dislikes.
That must be quite difficult for a lot of people to realise they're the architect of their own.
It's hard. It's really hard. And I think that's why mindfulness isn't easy. I think it is hard when you think about it. In reality, we all see things through our own perception filter, don't we? Because although we're all sitting together in the room, none of us are seeing reality as reality is. We're all looking at our view of reality. And even this talk, we'll all have our own perception of whether we like it. None of us are sitting here feeling neutral about what we're doing at the moment. Yeah, everybody's got a view or an idea or thoughts going through your mind. Nobody's just sitting here having exactly the same experience. And when you think about how that plays out in life, and when it's something that's actually serious, because this isn't serious, anyone could just go home, basically, couldn't you? Like no one, yeah, you could, couldn't you? Like you could, couldn't you? Anyone could do. This isn't serious, and yet we're all having completely different ideas. But imagine if this was something that was really important in your life, or something that was very emotive. You're looking at it through your own perception filter, which might be colouring it in a very different way to what reality is.
I actually find the mind more interesting.
It's amazing. So should we do? We'll just do a practice. Now everyone's gone. We'll do just a 5 minute. So what we're going to do is just notice where your mind goes. So if you're someone who does meditation and mindfulness, don't try and bring it anywhere. Just let it do what it wants to do. So the aim of this is with mindfulness, you never lose awareness of where you are. You never lose awareness that you're sitting down. You won't lose awareness of the room or anything. If you ever lose awareness in mindfulness, then you've either taken yourself into a completely different space or you're zoning out, which isn't what mindfulness is. You're always fully present in your body. So we'll just do 5 minutes. And every now and again, I'll just sort of interrupt, say, where's your mind? See if you can bring it back. And all your aim is, in 5 minutes, is to just allow your mind to think about nothing. And just see where your mind goes in 5 minutes. And see what you do with your mind when it goes. There's no right or wrong way, just see where it goes and what it does. So I'll write down 5 minutes. And you can just sit however you want. And just noticing where your mind is at the moment, wherever your mind is, to see if it will allow you to bring it back to just focusing and thinking on nothing, nothing at all, nowhere to go, nowhere to be. To see if it will allow that. And if it's attached itself to a sound or anything, to see if it can detach. You're simply being curious. There's no right or wrong. And again, just notice where your mind's gone. If you're attaching to any sensations, sounds, see if your mind will allow you to detach it. Bring it back to simply doing nothing. And then just bringing it back to just paying attention to where we are in the room. How did you find that? There's a lot going on around us. What did your mind want to do? Where did it want to go?
So many levels. I felt like I had the present moment. Had the present moment. Had lingering emotions and thoughts. I then had the noise of everything around me. Yeah.
Yeah, I feel like it was good when you said about if it's attached to any sound, because I attached to that music.
Oh,
Yeah.
okay.
And then when you said that, I like tried to stop that, but I feel like it always takes me internally.
Yeah.
Like, my breathing, and then I was like, feeling like I fall asleep.
Yeah. Yeah. What about anything come up for you when your brain was just left to its own?
Outside.
Yeah.
But if I think about my breathing when I'm doing it,
so you felt you had to have that anchor, that breathing anchor.
Yeah.
Yeah.
If I think about my breathing, and if I count my breathing,
Yeah.
then
Yeah.
I could not think of anything else.
Oh, really?
But it's so easy, like even like the sound of like the fan in one of the rooms, and then the music, and then like I'll see someone outside, and then but then when you said something, I would think about actually go back to counting my breathing again.
Yeah.
It's very easy to.
Yeah. And also it shows us how every minute of the day our brains are actually multitasking all the time. And what we often do is when we're focusing on something, we'll really focus. Quite often when people are trying to practice mindfulness and meditation, you will focus on the breathing with such a tight grip that if you let go of the breathing, you're not going to be able to do it. But the reality is, even when you're doing the breathing, it's a light touch. It's like, oh, we'll do one later with breathing. It's like, oh, I'll just come back to breathing. Oh, my brain's gone off. I'm coming back. And it isn't easy. It isn't easy. And I always think that it's like when I talk to clients about when we're trying to change patterns of behaviour, I would say when you imagine our brains, especially when we're dealing with certain thoughts, people, behaviours, we've got the whole M25, we've put lights on it, we've got cafes, we've got it all going on. And when we go down that thought process of that person, that thing, we're down the M25, literally, straight away, M25. And with mindfulness, what we're asking you to do is instead of going straight on the M25, is you see that little woodland there with that little pathway that no one else has gone before, you've got to go down there and create your own new M25. And naturally, our brain's going to be like, no, I want to go there. Well, that's why it's a conscious thing. So mindfulness is consciously moving ourselves away from the M25, down to the woodland path. Yeah. And that's why it's hard. Because our brains always want to go down the easy route because that's the route that we plough through all the time. But the reality is, we're all learning new pathways every day. And there's no reason why we can't go down the other route. It's a conscious thought.
You're saying that your mind goes back to the M25? Or?
No, I'll do that down the woodland.
Oh, okay.
Yeah.
No, that wouldn't scare me. If someone told me I had to do that.
Yeah. But for a lot of people, the idea of having to consciously change it is too much. They'll always go back down. And it's not about the fact that you won't. You'll always go back down your old patterns. But it's about going, oh, I've gone down that road. I've gone down that path. It's okay. I'll bring it back. Oh, I'm starting to have those thoughts. It's okay. I'll bring them back.
I think that's what a lot of people get scared of, don't they? Like, then going down the wrong end, but it's okay.
Yeah. Yeah. And also a lot of people are scared of their thoughts. A lot of people actually don't want to practice any form of mindfulness because they're scared of what is happening in their brains. So they're spending their lives constantly distracting themselves because if they notice what's going on, they'll find it scary or they'll feel like they've got to do something about it. Yeah. Yeah. And the reality is you just have to know where your brain's going. Sometimes you can't do a lot about what's happening. You just notice where you're going. Oh, I've gone down there again. And oh, when I'm around these people, I tend to always have these thoughts. And when I'm around these people, I always act like this. When I'm in this place, I tend to act like that. Isn't that interesting? Isn't it curious? Isn't it interesting how we all act differently when we're in different places and how it brings that part of ourselves. And what we're learning is that we've all got these different parts that we show everyone. and we're just learning how to bring them out.
It sounds like quite a nice, healthy way. You're almost taking ownership out of it. So you're not identifying the individual with the flaws, because the individual's observing the flaws. So, and also like the way that you're expressing it, isn't it interesting? Isn't it curious?
Yeah.
That you observe these things, or you experience these things around different people. It sounds like it takes the burden of it away from the mind. Like just you talking about it like that.
Yeah, because when you think about it, we spend most of our lives criticising ourselves and being self-judgmental, like, oh, why have I done this again? Why have I done that? And actually, it's interesting that we're doing that again. Isn't it interesting that I've done that yet again? Yeah, it's about how we talk to ourselves, isn't it? And that's why mindfulness. When when people talk about mindfulness and they're talking about woo-woo, they're often talking about the compassion side, the loving kindness side, which not all mindfulness-based courses have. But to me, the self-compassion is the least woo-woo thing that we can do, because compassion is, I hate myself, I'm not good enough, I can't do this, I don't deserve this, nobody will love me. That's the inner critic. So when we're showing self-compassion, we're just basically saying, actually, I'm okay. So it's one of the least woo-woo things out there. And yet, because it's got the word compassion and people associate compassion with, lose the voice, with woo-woo, people just ignore that part. But if you're working on compassion, you're working on, I hate myself because when I was a child, this person did this to me. I can't do this because when I was at school, that happened to me. I can't do that because I was bullied as a child. That's self-compassion. It's like accepting, it happened in my past. I'm able to just see that without attaching an emotion to it, and allowing myself just to see what it was. That doesn't have to be me now.
Is there any research about, like, as you get older, you naturally start applying this? Because like so many people say, oh, when you get older, you have more of these books and this, like you'll cut out like people that might make you
a lot of research won't research on people over 60, especially to do with the brain and the thought process, because they think that as we get to over 60, because our minds start to naturally degenerate, I suppose, whatever, they won't include them, because they say for research purposes, you can't then have as valid. And also the same with that younger, so that research for the younger population, because your brains are so that you're still learning. Yeah. So, and yet the older generation in some ways can have more fixed minds than anybody, because by then you've had years and years and years and years and years of repeating your patterns, so you can actually have more. And a lot of the research won't include them in the research because of them being, their brains are actually, because your brain is, if you're someone that hasn't practiced meditation or mindfulness, they often won't take it into account. So mindfulness, as it is, it's basically lets us know if our brain's left to its own devices, all of these thoughts and things will just flow, just like a river, they'll flow, and they go. The only thing that's keeping them in our head is us. And the biggest gift I think we can give ourselves is to understand how our mind works, understand that 90% of the time our subconscious has been controlling our mind and our past programming has been controlling our mind. We can't stop bad things happening to us. We can't stop people disliking us. We can't stop negativity. And again, that's something that people struggle with, because it's not nice to think we're in a world where a lot of people are like, I don't want people to dislike me. And to be fair, not everyone's going to like us. But do you like everybody that you've ever met? So why should they like you? If you look at it that way, you don't like everyone. Why should everyone like you? And yet a lot of us have issues with the fact that people won't like us. It's the whole people pleasing, but that's our past programming. Why am I a people pleaser? Why is that my default mechanism? I was listening to a podcast, so Matt Willis from Busted, I think, was talking to Dougie Pointer from McFlurry. They've both got addiction issues. And Dougie Pointer, I think, has been in rehab twice for addiction. And he said every morning he gets up and one of his first non-negotiables of the day is to just check in with his brain and go, how am I? Because how he is when he gets up in the morning will help him determine how he's going to be through the day. And I think that's the best thing that we can do, just go, how am I? Or just do that 5 minutes. 5 minutes, where's my mind going? Where am I? Just to see where we are. And I always think if you compared mindfulness to physical training, for me, because mindfulness is something that we learn. For me, it's like if you went to a PT, the first thing you learn before, like you wouldn't walk into a PT and go, I want to learn how to do heavy weights, and then go, there's a 20 kg kettlebell, off you go, pick it up. They'd be like, no, you've got to start light, you've got to have your form. And for me, mindfulness is the form. It's the bit that you start with and you base everything else on top. You learn the form, you learn the basic skills, and then you add all the other things. So it's a day-to-day, yes, there is formal practice, but it's a day-to-day, where's my mind going? How is it at the moment? Oh, I've just reacted in a really weird way to that. I haven't got time to deal with it at the moment. Maybe I'll take it home and I'll notice it then. It's just about noticing. And that's basically what mindfulness is. And there's a few quotes on it. It says, between stimulus and response, there is a space. In that space is our power to choose our response. And in our response lies our growth and freedom. And Tara Brach says, mindfulness is the pause. It's the space between the stimulus and the response. That's where the choice lies. And that space is in our subconscious mind. It's not in our conscious mind. It's there, which is why if Elliot says something that I really dislike, somewhere in my subconscious, there will be, this is how you respond. And when I'm practicing mindfulness, I'm learning, why is it when Elliot said that, I responded in that way? Maybe I'll respond in a different way next time, but why did I respond that way? What is it about Elliot that when he does certain things, I react in that way? What is it about Charlotte that I react in that way? It's just about being able to say, okay, what's my subconscious mind picking up that my conscious mind isn't aware of? And a lot of us, I think, in the modern world, we tend to live our lives in the newer part of the brain and the thoughts and the thinking and that side, when actually a lot of our responses, when you think we were, young children before we can actually verbalise life, we've already decided, do I feel safe in the world? Am I listened to? Is it safe for me to be angry? Is it, am I anxious? We've already decided that before we can even talk. And yet, as an adult, most of our responses, when we're trying to see why have I responded, we're using this logical bit of our brain. And that isn't even switched on when we're thinking about responding. It's all responding from that. If when you see people having temper tantrums and getting angry, that's the childhood response coming out. And yet we never say, why am I reacting in the same way I did as a child? Why is that still happening? And learning how our brain works allows us to say, oh, that's why it's happening. That's what's happening. The modern day definition of mindfulness, how everyone looks at mindfulness, the buzzword mindfulness, the all-seeing, all-wonderful God of mindfulness that everyone looks at, that's based on the work by John Kabat-Zinn, he was an American doctor in the 60s, 70s, and he was working in a hospital in Massachusetts, and he had patients who were not responding to traditional medicine, and they had chronic pain, among other things. And he was not necessarily practicing Buddhist, but he was sympathetic of Buddhism, and he'd been to meetings, so he was looking at ways to try and bring new things. And he brought a lot of Buddhist thoughts through, which would be about your present moment, acceptance, but he deliberately removed anything that related it to Buddhism because he wanted to get it through the American Medical Association, and there was a lot of prejudice against mindfulness. So he brought this first class, which he taught in 1979, and he first called it the Stress Reduction and Relaxation Program, as in like, no mindfulness involved here, guys. And it was only when it became established and people said, oh yeah, this actually does work, that then mindfulness became part of it. And the definition of mindfulness that everybody, modern day, that you talk to now, it would be paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. And that is very, very hard. Because as humans, we struggle with a non-judgmental side, we struggle to stay in the present moment, and we struggle to actually pay attention where our minds are like all over the place.
Even like as children, like it's rare for you to be allowed to like wander and your mind wander. And you not to make it just like you hear all the time. Stay still, like this.
Yeah.
And it probably it's just the society thing, isn't it? It's like years and years of conditioning to be like conformed to.
Yeah, and they say some people naturally have more dispositional mindfulness than others. So if you've never actually ever done any meditation in your life, anything, you could still actually be somebody that doesn't react, is very reflective, because whether it was your upbringing, whether it's your culture, whatever it is, you've got that instilled in you. So you might be someone that doesn't even agree with meditation and mindfulness, but still be one of the least reactive people, the most thoughtful people, because you've already got that in you. Because we all of us sitting here, our baseline, if we never ever did any meditation, we'd all be different. And I always find that interesting that, you know, obviously our background, our culture, everything plays a part in us as we're forming, doesn't it? So myths about mindfulness. Mindfulness is about emptying the mind. No, our mind is not designed to be empty. That would be a little bit silly as humans who are still living in a world where there may be predators. We actually do have the default mode network of the brain. So when we think we're relaxed and chilling and doing nothing, that bit of the brain is still working. So our mind is not meant to be empty. And mindfulness never wants us to empty our mind. It never wants us to go into a trance-like state. It doesn't want us to not be aware of where we are. It's about bringing awareness, saying, oh, I'm sitting on the chair, I'm in this room, I've got these people around me, I've got a light touch on my breathing, my mind's just having a little flit around, and I'll just bring it back every now and again to my breathing. But I'll never lose awareness of where I am. Mindfulness and meditation are the same. So I've taught meditation for years. I've taught 6-week introductory meditation groups.
So they're not the same, so.
They're not the same.
No.
Yeah. So I've taught 6 weeks introduction to meditation, and that will incorporate mindfulness techniques like it will incorporate breathing. But meditation, you're looking at maybe you can do chanting. We've done mala beads count. We've done breathing. We've done all sorts of visualizations. And meditation, if you look at it like meditation is a practice. Mindfulness is, for want of being all cliche-ish, is a way of life. It's a way of being. It is how you are. And there will be a formal element where you may sit down and you may just do a formal practice. But the idea of mindfulness is that when I am out in the world during the day, I am acting in a conscious way. I don't have to go home and then do a 15-minute meditation to try and bring myself back into myself. I mean, I'd liken meditation is very much, I mean, I love meditation. I still teach meditation. I still go to meditation. I think it's great. I think there's a place for everything, but it is different. And the reason that I've worked with many clients who've said, but I do meditation every day. I go home and I meditate, but I'm still really not okay. But I think, well, imagine if you're at work and your workplace environment is very, very stressful and very, very difficult, and you're absorbing all of this at work and you're on automatic pilot. Going home and doing 15 minutes meditation, yes, it will split you away from the work thing, and you'll be like, oh, I'm ready for the evening. But it doesn't take any of the stresses away. It's like, imagine if you were going to work and you're eating Mackie D's and Burger Kings, and then you go home and you eat a salad, and you go, whoa, that salad's not doing me any good. It wouldn't, would it? It's the same.
Do you have techniques on how you can highlight to some of your clients how they might already be practicing elements of mindfulness throughout the day?
I would say whenever we're doing anything where we are only doing that thing and we're really absorbed in it. It's like, imagine if you're, mindfulness even incorporates, say you're listening to a song and you're really into that song and you're just singing away to the song. Or if you're going somewhere you've never been before, so you're really aware of, you're looking at the door numbers, that's mindfulness. Like anything where we're just doing it and we're absorbed in what we're doing and we're not doing it and looking at our phone or having a chat to someone else. And we're all doing it every day. We're all practicing mindfulness every day, day-to-day life. And like you guys, when you give people rehab, if you say to someone, right, you've got, I mean, what rehab have you been given for your shoulder?
Oh, you didn't do anything. I did but you checked over. So just so an exercise where you raise the arm up and down, another exercise where you rotate the arm in and out.
And you just randomly do that?
No, with intention.
Exactly. So that's mindful movement. I think we give things names and we think because it's given a name in this particular place, therefore it only fits there. But every time you give someone rehab and you say, okay, do this until you feel this and notice this and only move it till this, that's mindful movement. That's an element of however long. So how long would you say, or how many minutes would you say to someone to do that for? If you're just giving them maybe
3 minutes.
Yeah, that's mindful movement. And if you were saying do that a few times a day, you're giving that person mindful movement 2 or 3 times throughout the day.
Does the mind ever get tired of being mindful?
No.
Okay.
No. I think what happens is we get tired of having to keep bringing it back. The mind itself doesn't get tired, but we get tired.
So say if I'm trying to work in a mindful manner, me ignoring my tiredness is a way of actually not now being mindful because I'm not actually accepting that I'm getting tired.
Yeah.
When you're being mindful, you're using more energy than
when you're when you're being mindful, when you're first, because like there's research that shows that people who haven't done mindfulness before and first learn it, they're operating from different neural pathways from people who've been doing it for a long time. So when you first start doing it, it is an effort, and your brain is trying to consciously reroute everything, and it is an effort because you're having to think, I wasn't going to look at my phone, I wasn't going to do that. But once you've got in the habit of doing it, you actually then have different pathways light up.
That's interesting.
Yeah, you're not just
streamlines it.
Yeah. Yeah. So the more.
Would a good example be like when I first qualified, it might have been really exhausting for me to see like 4 patients a day. I find that exhausting when you're with a patient, you just give all your attention to them and what they're saying. But then now, like 18 months down the line, I can see all their patients.
Yeah.
And I'll only be tired towards the end of the day.
Yeah.
Would that be because those neural pathways have built up?
Yeah. Yeah. I think anything when we're first learning it is really hard, isn't it? Whatever we're learning, because we're consciously learning it and we realise, and then we get angry with ourselves because we want to do it better. I say when you first start practicing mindfulness, if you're just doing it on your own, just 5 minutes at a time is enough. Because that 5 minutes we did, that's a long time. Just do it 5 minutes at a time. I think what happens is people have never practiced any kind of meditation or mindfulness, and they'll go, we'll do an hour, they'll sit there, they'll do their hour, it doesn't work, so they think, well, that's crap, I'm never doing that again. If you ever start mindfulness the first time you do it, 5 minutes, just give it 5 minutes.
And people think like doing it once is going to change.
Oh,
so
yeah.
do it like every day for months.
And they say if you did 10 minutes a day, every day, it makes much more benefit for you than just doing an hour once a week.
Oh, okay.
Yeah. Yeah.
Less is more. Less is more.
That was something. And Michael Mosley, bless him, the doctor that recently died, he did a lot of research on that where they actually wired him up, and he did lots of different meditation, and they found that if you just do 10 minutes a day, that's getting you in the routine of doing it and it's becoming a habit. Whereas if you do 1 hour a week, it's going to be harder work because you're going to be consciously having to do it, probably less likely to keep it up, and you're not actually going to get an awful lot of benefit out of it. So, I mean, I say 5 minutes every now and again when you've got a moment during the day. Just 5 minutes. If you've got 5 minutes, just, where am I? What am I doing? Checking in with myself. That's all you have to do. You don't have to worry about silence or anything. Just checking in with yourself. So when people say, mindfulness is easy, it isn't. Times to not really, there's never a time when people say don't start it, but if you've had something huge happen in life, like a bereavement or that, your mind's automatically going to be like, this is not a good time necessarily to start trying to bring mindfulness in. Or if you've had like a really big life change, people, like I said, with trauma, PTSD, I'll talk about that at the end because that's a little bit different. But yeah, if you a lot of people I see, they'll come to me and they'll say, I went to my GP and I was told to take antidepressants and learn mindfulness. And quite often, by the time I see people, they're in a place where they haven't been mentally okay for quite a long time. So suddenly bringing mindfulness in, you've got to bring stuff in gently. If you've been mentally in a bad place for, a year, and then you've only walked through a counsellor's door because everybody said you have to go, there's a lot going on in your brain. You can't easily start going, well, let's just introduce mindfulness into your life. You've got to bring it in as part of a therapeutic process. It's not that easy. The best time to learn anything is when you don't need it. When you think your brain's okay, you think, this is when I'll learn it, because that's when we're more receptive, that's when we're more able. And then when things do go wrong, we've already got the practice and we've already got that in our lives. And it's not going to take away what's happened to us, but it helps us to recenter again. And I would say that, if you're the first time you try mindfulness, I always say to people, even anything where we're trying to change our brain, imagine you've bought a puppy and you take your puppy out for the first time in the park, and you go, take your puppy off the lead, might come back eventually. I'll call it many, many times. I've got no idea where it's going to go. And eventually your puppy comes back. That's your brain the first time you practice mindfulness. It's like, you've let me off the lead, and it goes everywhere. Eventually, with your dog, you'll be like, oh, when we go to this park, it always likes going in the woods. Sometimes I have to call it a few times and it'll always go there. And when I go to that park, that's what our brain is. It's no different to an animal. We're training it to keep coming back. It's never going to stop going away. And I think people want perfection. I'm going to train my brain so that it will never wander again. I will always have full control. It will never happen. Our brain will always wander. It's always about us going, oh, I've trotted off, I'm coming back. Our brains are always going to be like the puppy, always wandering off. We're training it to come back more than it goes away, but it's always going to go away.
Also training yourself to be observant of where it does.
Where it wants to go. Yeah, because we're like animals. We are animals. We will always do the same thing. As I say, we operate on the past, and we'll repeat past patterns, and we'll always be like that. We're learning, like say, consciously rewiring ourselves till eventually we start noticing. Another thing people say is, I have a busy mind, therefore I can't do mindfulness. Anyone can practice mindfulness. People who have ADHD, who have like really, really busy minds, people, then you're looking at adapting it to suit you. Some people with ADHD really struggle with silence. Some people with autism, they can actually struggle with silence to the point because they're so sensitive. I've worked with autistic people who can hear electricity, and they can hear things like that we can't even pick up, and have noises in their head. So then you would be adapting it. So you wouldn't necessarily be saying, let's just sit down and practice it. It might be, okay, you want to be doing more like mindful movement or stuff that isn't you sitting still having to do it. So it's not about you can't do it. It's about adapting it to suit you and how your mind, so again, it's learning, how does your mind work? So therefore, how can this work for you? Bringing it to your own mind. Again, people say it's just relaxation. So they've actually done research on this, and they did a mindfulness versus autogenic relaxation program, which is where you just release and tense your muscles. And mindfulness came out that people who practiced mindfulness had less distraction, less mind wandering, and they put this down to the fact that they believe that mindfulness is an active thing. You're actively doing it. It's a conscious thing. It's not a subconscious thing. And because it's a conscious thing and we're actively doing it, they believe that's why it works. Whereas autogenic relaxation, you're just relaxing your muscles, but you're not trying to actually do anything with your mind. That's what I think. And also, what we have to remember is that we are working with an old mind that has had lots of bits added to it. The mind we're working with, they say the modern mind as it is, probably started forming around about Ice Age, which bears no resemblance to how we all operate now, when we would have been, our reward system would have been, have I found somewhere safe to live? Have I got food? We would have been still hunter-gatherers, hunting food. There would have been predators. And the parts of the brain that were responsible for that, which is basically quite often the limbic system, your amygdala, all of that, is there a noise in the bushes? Is this a threat? Weirdly, they're the parts of the brain that are also involved when we're looking at art and when we're listening to music, because we didn't form new bits of the brain. We just attached a new pathway to the bit that was already there. And that's why we often have like visceral reactions to music or to art, because it's the same part of the brain that, when I was living in my Ice Age world, I would have been like, actually, this is scaring the hell out of me. I think there's an animal in it. And that's why apparently we like puzzles. They say the human person likes puzzles because they believe it's from having to find predators in the bushes back when we were literally hunter-gatherers. And I think that's why it's quite important for us to know that the brain that we're working with, we've added to over the years, but basically the emotional part of it is the bit that will always overrule the new part. So the new part, the bit that we're all sitting in here now, the logic, the thinking, the thought mode, any situation that we feel danger, that goes completely, doesn't it? If somebody suddenly runs in that door and we feel threatened, none of us are going to think logically. We're going to go straight to the threat part. And that's why anything that formed when we were younger and non-verbal, when we're trying to deal with it as an adult, we can never deal with it with our logical part, because it wasn't formed when we were being logical. We have to be able to attach to that, the compassion. When that formed when I was 11, what was happening in my life when I was 11? Can I go back there and see what that was like? Because I'm not 11 now, so anything that formed when I was 11, there's very little resemblance to my thinking brain now. And that's why a lot of people go, well, why can't I do this? Why can't I change my thoughts? Why am I reacting to that? If it was formed when you were a child, it was formed long before the thoughts that you're working from now, the executive function part was formed. Yeah, long before that part. And what we're trying to do, and with mindfulness, we're saying to people, look, you're working with an old brain that's basically attached, all these bits onto it. The limbic system, is fight, flight, freeze, but also, oh, I love that art. How bizarre is that? Oh, I love that music. No wonder we're confused as to what we're doing, because to the logical us, to the adult us, it's not like 1 and 1 makes 2. It doesn't make sense, does it? So the more we get to know our brain, the more we get to understand where our brain goes, and actually, when did I form that? Oh, that might have been. And the more we start to understand, but that's what we're scared of, because a lot of us don't want to go back to, oh, actually, I've had that thought process for many years. Well, I wonder when that formed, because we don't want to go there, because that's when it all gets scary. And then because we don't want to go there, we try to deal with it with logic, and because we can't do that, we stop.
Is that because the logical mind doesn't experience? Like the logical mind can compute, it can give opinions and arguments and balances, but we experience life emotionally.
Yeah.
So then to try and apply, it's almost like oil or water, like
Yeah.
Okay.
If you had an experience, if you were, when you were 5 or 6, you had this experience as a 5 or 6 year old, the part of your brain that you're operating from the majority of your day wasn't even online then. So if you're trying to go back to that 5-year-old, that's why when in counselling, when they talk about like inner child work, you always do it through visualization and connecting with that person. You never do it as the adult.
And compassion.
Yeah, and compassion.
Comes into
Yeah.
it? So compassion isn't a logical thing.
Yeah. You're connecting.
Yeah.
And self-kindness.
Okay.
Now, it's not your fault that as an adult, your thoughts have gone there, because that happened when you were a child. That happened to you. It's not your fault that happened. But what you can do now is understand it, be compassionate and kind to yourself, and go, okay, from here, we can learn to change it. I can't change the past. I accept, and that's the acceptance. I accept where I am now. I accept what's happened, but I can change it, but I can change it in a conscious way so that I don't keep repeating the patterns. And that's what we're sort of looking at. It's sort of looking at ourselves where we are, understanding where we are, and also noticing that we're still operating from that threat. But the threat to us is, the majority of people threat is, am I earning enough money? What about my job? What about my family? We're still in threat. So whereas the threat before was I might die, now the threat is if I can't pay my mortgage or my rent, I might lose my home. I might lose my relationship. So we're still operating from that part of our brain, but we're just doing it in a very different way. And also, we're operating from it quite often 24/7, whereas in the Ice Age, we would have had more downtime. We would have been like, I found somewhere safe to live. I'm living communally. I'm with my people. There will be people on guard, therefore I am safe. Whereas now, the safety that we tend to not live communally, we can be isolated. And also mindfulness is very into being connected to humanity, which is the whole loving kindness. I see you, I see the world, I'm connected to you and I'm connected to the world. And that's the loving kindness part.
Also, like, when you're talking about that balance between like uptime and downtime, and it historically being much more, the uptime was much more acute than the downtime. Whereas now, it seems that the hunt or the mindset of the hunt is prioritized. Like, you can do it 40 hours a week, good. 60, 70 hours a week, even better.
Yeah.
And the less downtime you need, even better.
And they say, you know, that the 8-week course we're doing, they actually bring up pictures as threat and drive. Like, where are you living? You know, are you living in threat? Are you living in drive? And quite often what they're realizing is the soothing part, we subconsciously go into threat and drive, but we're consciously having to say, oh, what shall I do to make me feel better? What shall I do to make everything okay? And that's when we do the maladaptive behaviours. Oh, I'll feel better if I have a bottle of wine. I'll feel better if I'm taking drugs. You know, I'll feel better if all of this happens.
So even these maladaptive behaviours are all about trying to self-soothe.
Yeah, it's our way of
get you back into that more.
Because we're soothing in a, either I want to ignore what's happening in my head, so I will numb it.
Yes.
Or I will distract myself by doing something different.
Yes.
Or I shall. I don't like where my feelings are going, so I shall not eat. Or anything to do with food is emotional.
And it sounds very much like the way that you're listing them all off. It sounds very much as trying to do it as speedily as possible.
Oh, like, yeah.
I need to get ready for Monday or by tomorrow. So
yeah. I mean, I have people come in and see me who've obviously been mentally unwell for a long time, and they're like, "But I need to be okay now. You need to fix this now." Like, and I'm like, "But yeah, like mentally." I'll say, "Well, how long have you not been well?" And then they will realise they've not been well for a long time. Well, how can it go back now? But we live in a world where we want that instant fix.
And also, is there because obviously people pick up on other people's moods and text them, like, you know, they say, oh, if you next to them, they're always arguing, or stuff like that.
Oh yeah.
100%.
Yeah, and that, I mean, bad neighbours. I mean, that can affect your mental health amazingly if you have bad neighbours. Because it's things that we can't control. Yeah. When we're living in things that we can't control, or things that are ambiguous and we can't see the end of it, we tend to go straight into that threat system. Like, this is a threat to me. I can't control it. I can't see an end to it.
But
and once we're
being mindful of
and then it's about what can I control. And sometimes we can be so stressed that we think I can't control any of it, rather than what bit can I control.
Yeah, you can control your reaction.
Yeah. And with mindfulness, what they're finding with the research is that, I'll go through some of the research, is that even if your environment doesn't change, you can change your the way you think about things. Your environment might be exactly the same, but it's your inner workings that change. And what we're trying to do is connect. And quite often we find that people operate either in a physical or in an emotional. It's like they cut off. They're either stuck up here or stuck. So they were either having a complete panic attack, complete melted, everything's gone, or we're up there and we're trying to control everything. And it's like people who don't eat. Their body's craving food and saying, please feed me, but their mind's going, no. And with mindfulness and a lot of meditation practices, it's a circuit, and we're saying you're a circuit. That body scan, we're a circuit. We're all trying to connect. Anything to do with the body, it's all connected. And also, when we're working with the body, we're just saying, is there a part of your body that doesn't feel connected at the moment? Is there a part, if you're doing a body scan, is there a part of your body that won't let you go there? Is there a part of your body that, that just says, no, you've not got access here? And that's, just curious, what's going on with that part of your body? It might be a part of your body you weren't even aware you had an issue with. And that's interesting as well, because, and some people, if they're in pain, what they found in some of the people with pain is, like you find, I mean, I'm not going to tell you about pain, because you work with pain, you know all about people with pain, is that when they're doing the body scans, they can't get to the bit that got the pain because they can't go there.
People also relay that kind of thing in their language. Like people will say, I just want someone to lob it off.
Yeah.
I just want to put it beside for one time. I don't want to have to deal with this leg, or that they're like, and they kind of even like when they're explaining it, they'll kind of lean away from it and I'll be doing this kind of movements to. So I can see that.
Yeah. So if you're doing a body scan with someone and they can't connect to that part of the body, say it was your shoulder and you just couldn't get there, you'd be okay. If you can't get to there, what can you get to? What's the closest to it you can get to? What bit of your body will it allow you to get to? Will it allow you to get to any of the muscles around it? Will it allow you to go up to your neck? Where's your body letting you go, and how close can it go? And if you're doing movement, what they're finding, it's great bit of research. There was this research which has got nothing to do with mindfulness, but I just thought it was amazing. They had, which you probably all know, when they were training people to see if we imagine movement, does it have as much effect as the piano one? You know the piano? They did the piano one. They had people who every day for a certain amount of time were practicing the keyboard, certain piano keys to strengthen their fingers. So every day for a certain amount of time they would do this practice. And they had other people who for exactly the same length of time at the same time would imagine that they were doing the piano exercises, but without doing the exercises. And they did it exactly like the others. And after the experiment was ended, the people who'd been doing the exercises, they had their fingers were strengthened by X amount %. And the ones who had never done any finger exercises, they still had more strength in their fingers. Yeah. And it just shows that if our mind says, and they've also, when we're looking at pain, they say that if somebody believes they can't get better, all the research says if somebody believes they can't get better and there is no way that they can get better, they won't get better. If they've convinced themselves they won't get better, it doesn't matter what they've got. If in their mind they say they can't get better, they won't get better. But yeah, and I think one other thing that when you're looking at mindfulness is connecting with others. During lockdown, I did online for Frazzled Cafe, which was going before lockdown, but on lockdown it went online. And basically, it's if you don't feel okay, you would log on to Zoom. It's run by Ruby Wax, the American comedian. She started it, and you'd have up to 17 people, and I'd just sort of facilitate a group. And it could be anyone. It could be people who it was locked down. It could just be people like us who's like, I feel disconnected from my family. I can't go out and see them. Things aren't okay. Or it could be people who had been struggling emotionally beforehand. And there were people in the group who said that they felt like they didn't feel like they could communicate with people. But what they would do is they would go to the free museums and art galleries, and they would just walk around the museums and art galleries, so they felt a part of being with people, even though they knew that they didn't want to talk to anyone and they couldn't talk to anyone. So they would just sit in an art gallery and feel that. And that's the common humanity. And when you think about it, we used to live community. We are designed to be around people. And when we're depressed and anxious, we cut ourselves off. and we are more likely to say, I won't go out, I'll bring the mood down, no one wants to be around me, all of those things, when actually what we need.
Doing it, really.
Yes. Yeah, we're our own worst enemies, aren't we? But it is interesting how we are designed from literally historical times to be around others, and yet the more emotionally unwell we are, the more isolated we are. And that, yeah, I never realised that with lockdown, that people would actually just go to museums and things and just walk around, and shopping centres, just to be around people, that they just need that link with people. So we're never trying to lose thoughts, we're never trying to empty minds. And things like acceptance, commitment therapy, dialectical behaviour, they're mindfulness informed, but they're not mindfulness based. There's a difference. So mindfulness based is everything comes from, you'll be doing body scan, anchors with breathing, compassion, all of it is based on that. Whereas you've done acceptance, commitment therapy, so there is a difference. Did you want to do another practice?
Yeah.
Go on then. We should do a kindness exercise just to see how we feel with kindness. So again, let's settle our mind. You can keep your eyes open if you want. Keep your eyes open. Yeah. Just if you keep your eyes open, just sort of put your gaze somewhere where you feel it's a neutral gaze. So, yeah, not Elliot. He's not. You know, as we say, is anything neutral? We put preference everywhere, don't we? You know, nothing's neutral. So just bring to mind and memory. And this is when we're talking about kindness, we're talking about a small thing. It doesn't have to be anything big. When someone was kind to you in the past, just think about what happened. Let's go through the event in your mind and just see if you can attach yourself to how you felt at that moment in time. See if you can experience it in your body, any sensations. If you can't experience it anywhere other than thoughts, that's absolutely fine, but just see what you can experience. And now if you can detach from that past you and the current you, just see how the current you feels about that experience. If it feels the same, if it feels different in any way. And now bring to mind a past event when you were kind to someone else. You don't have to have done anything big, just an act of kindness to somebody. Just notice what you did, maybe where you were, who you were with. And again, see if you can bring any sensations. See what comes to mind. And again, see if you can separate yourself from your past self and see if the current self, just bring the thought to mind, this happened in the past, I was kind to somebody. See if you can notice what you experience. And it may be it's purely a thought, it may be there's some physical sensation, Again, there's no right or wrong way to experience this. And then just allowing your thoughts just to go back to a neutral place if you can, and find a neutral place. And then just coming out of that moment and just coming back again to everybody else in the room. Who was able to connect with the past? What did you connect with?
So I was like, it took me to when Noosh took me out for my birthday. So we had some nice food. That was really nice. So just like sitting in that moment, and then like compared it to how I feel now. And I was in at the moment my heart feels quite heavy because she unfortunately she miscarried at 12 weeks on Thursday. So then I was kind of just like reflecting on that difference between how I feel now and how I felt then. Then when you said like think about how like something kind that I've done or said to someone else, like when she miscarried, we were just sitting outside, and I said that I would rather experience an infinite number of miscarriages as long as I'm still by your side. And then she just sorry.
Like everyone crying. We're all welling up.
Yeah.
It's just like still bad. Dealing with it, but I had the sensation that it was, that when I thought about that, I had the sensation that it's going to be alright. Okay, so,
Yeah.
yeah. What's
You went to a deep place.
yeah, only because you took me there, Trish.
Sorry, I'm sorry I took you there.
That's all right. It's good.
You did. What can you take out of that, though, that you can take away that doesn't leave you in such a dark place? Because you are going to be in a dark place for a while. You're not going to come out of that place for a while, which is natural.
Yeah, I think I see it as part of the whole. You know, like my darkness or that experience of darkness, I've got no qualms with why it happened or what led to it. I understand that it's part of the whole, part of nature. The same nature that led to the miscarriage is the same nature that led to my birth, Lucia's birth, our births, birth of everything that we see. So I've got no qualm with it. I just know that I'm going to have to sit with that sensation for a little while.
Yeah. And that's a big mindfulness thing as well. If you want to connect it, is sitting with the feeling. Because they say that suppressing emotions, whatever the emotion is, whether we perceive it to be positive, negative, whatever it is, suppressing it further down the road is only going to cause us more pain. So being able to sit with it if you can.
Yeah, and
when you can.
Yeah, and also like I'm able to sit with it like like Winston Churchill describes his depression as his black dog, like it's with him. You know, like the sensation is with me, but I'm still able to work, to experience things.
Yeah.
I know, and I feel like, and maybe it's what I've learned over the past few years, that I can sit with it and acknowledge it, and it is less likely to hijack me.
Yeah.
If I do acknowledge it.
Yeah.
If I don't acknowledge it and I ignore it, then it's more likely to hijack me and throw me a curveball.
Everything that we ignore eventually comes and bites. If it doesn't bite us emotionally, it bites us physically. It bites us in some way. And that's where like distraction is good on a short-term temporary, because sometimes distraction for you will help you because you'll need it.
Yeah.
But not on the long term, where you're long term you need to be able just to sit with it.
Yeah.
Oh, it's yes. What did everybody else have? Were you able to just yeah.
I had like an interesting one when you asked us to think back about something that we had like the way you had done. Whenever I see someone that's homeless, I will always like buy them a meal.
Yeah.
I'll buy them some, like if it's good,
Yeah.
I'll get them a hot drink and I'll get them a meal.
Yeah.
But I know that generally when you do something kind for someone else, it makes you feel good. But in that scenario, I never feel good. I always feel like it's just not enough. And I always feel like I wish I could do more. I wish I could just take them in, give them somewhere to stay and like it's like that homely feeling. But I just can't do that. And I always feel like for them, they probably are really grateful for that. But I just always feel like it's never enough. And I wish I could do more.
Like you're scratching the surface kind of thing.
Yeah, like and I know there's loads of people that don't do anything. They just walk past and ignore it. But I mean, one time there was a lady at London Bridge Station, and she was like sitting on the floor, and she was just like hysterically crying, and she didn't speak English, and I had literally had 5 minutes for my train, so I really quickly went and got her something, and I just like had to put it down and then walk away to my train. But I just felt so bad. Like, it was so cold, and it was raining, and I just thought, like that was such an awful situation to be in. Like, I'm so lucky. Like, I'm going on a train and like going home to a warm house and got a nice warm bed. And I just feel like it is a kind thing to do, but I wish I could do more in that situation. So we don't feel awful for doing it, but I just think, I wish I could do more to be even kind to that person. But I'd say that's probably one of the only situations where you do something kind and don't feel great about it. I just wish more.
I wonder if that's like because of reciprocation, you know, like a lot of the time when you do something kind for someone else, it's acknowledging equality almost like, and I think you can do that with whoever. You know, you can give something to someone who has nothing and acknowledge the equality between you. But I wonder if that kind of theme of reciprocal, is it reciprocal? Reciprocate? Reciprocation. The idea that if you give someone something, you're also empowering them to give you something back, whether it is a smile or a gesture or thank you. It's like a stroke for a stroke. But if someone's homeless and they're down and out and they're crying, it's like you have literally nothing to.
But then you don't know that you giving her the meal, you might be the only person who actually saw her, Other people might not have. So you don't, So you actually seeing that person, that might mean a lot to them. And it's when we're taking it from our perspective. If you look at it from their perspective, you've actually gone and done something and bought them food. And no one else might have done that. And you're seeing them. And we all need to be seen.
I guess it's like when you're walking down the street.
We need to be, and homeless people, because I've worked with loads of homeless people. One of the biggest things is that when you become homeless, you technically become nobody because you don't have an address, you don't have anywhere, and I think they just need to be seen by people as human beings. Like, yes, you're there, and no, I can't do any more, but here's food, I've seen you. And that's enough, because with the best will in the world, you probably can't help them. And even if you help one person, there's going to be thousands and thousands of others you can't. So what you're doing is enough, because you're seeing them and acknowledging that they're human and that they're there. And it's a basic need, isn't it? Helping them with food. You look at it that way. Deep stuff, isn't it? Anyway, yes. When we're looking at, when we are looking at experiences, sometimes if we can, I think common humanity and being seen by others are massive. Because when we are mentally not okay, we often feel invisible as well.
What was the first one?
I think the common humanity is that we are all connected and being seen by others. Because when we're not okay, quite often we think We're just invisible. Like
Why is
everybody's.
that? Because we're out of sync with everyone else.
Yeah.
Oh.
Yeah.
Oh, like the whole kind of, well, like I'm standing behind glass kind of thing.
Yeah.
Yeah.
Everybody's
In a
doing their
fishbowl.
thing and nobody can see me. And,
Yeah.
and no one wants to see me because of what I represent.
Yeah.
So to see somebody is immense.
Understand.
Yeah, it's a huge thing. So yeah, looking at some of the research that's been on with mindfulness. One lady did 2 lots of research, Sarah Lazar, because she wanted to see what actually happens in the brain. And she said, so she did an 8-week mindfulness-based course, which is, loving kindness, compassion, mindful movement. We do a breath anchor, just the usual, what you will often find. And she found that one of the areas that the brain decreased was in the amygdala, which is the big fight or flight, and it actually decreased. It decreased, yeah. And because the amygdala, it doesn't know whether a threat's real or not. It could be a perceived threat. But if we feel threatened, it activates, doesn't it? And also the hippocampus. When people have PTSD, that's affected as well.
That's memory.
Yeah, episodic memory. Yeah. And with the mindfulness program, the hippocampus also was affected. Shaped like a seahorse, isn't that lovely? I think there's something in your brain shaped like a little seahorse. I don't know why. Yeah, it helps with regulation of emotions, episodic memory, and also one of the interesting things as well, which I find really interesting, is that the left and right side of the brain, the parts that deal with the mindfulness helps connect the left and the right hemisphere. So what they have found with research is that emotion, especially what we perceive to be negative emotion, negative arousal, tends to live more in the right side of the brain, and what lives in the left side of the brain tends to be what we see as positive. So we would be like joy, pride, anger. Anger, they put in the more positive one because they see it as it's like something that's it can approach us and make us do things.
Like a proactive emotion.
Yeah.
Okay.
I work with a lot of people who hate anger. They say I don't ever want to feel anger, but anger is just it's an emotion. It's one of our 6 primary emotions, and it's just an emotion. There's nothing wrong with feeling anger, and you might feel anger and it might actually motivate you to take action. So it's not the feeling anger that's the problem, it's what you do with the anger. If I feel anger, if Elliot does something to me and I'm so angry, it makes me take action and do something positive for me, it's given me that motivation. But if I then go home and then it then adds to depression and it adds to all of that, I've then absorbed it in a negative way. But you haven't done anything different. It's how I'm taking it. So anger isn't a negative emotion, it's just an emotion. But a lot of people really struggle with anger. I work with a lot of people who hate anger. And they never want to feel angry again, which is impossible because it's just an emotion. So, and what they found is that when you're practicing that mindfulness, it tends to help connect the left and the right side of the brain. And also, the more that you practice it, the more you start operating from the left side, which is more the associated with like the positive rather than negative.
The more you work with mindfulness,
the more you practice, yeah, it tends to open the pathways on that side of the brain. And interestingly, there's a big study in India that they did, and they were doing about sound and everything. And they find that so just to show that certain parts of our brain are always operating even when we don't realise, if we closed our eyes and did a purely auditory test, the occipital lobes and nerves would still be activated even though we would have our eyes closed. And if you think the amount of times that we don't realise that bits in our brain are firing because according to us we're not doing that thing, no wonder we don't know how our brain works.
Yeah.
If I think, well, obviously I've got my eyes closed, so why would the nerves in my eyes be activated? But they're activated because that's an auditory thing and it's all connected. So it just shows how, when we do talk about emotions, what I love about emotions, when we were doing research, is like And it says mood, like emotions have got a stimulus, so there'll be something happens, you know, someone will say something, so I'll react. I'll either react with anger. Disgust is one of the 6 basic emotions. Some people say disgust is a secondary one, but it's actually originally they had these 6 basic emotions that Paul Ekman created. And counsellors often have an emotion wheel. You put your basic ones in the middle, and then all the other emotions fan out to show how complex emotions are formed, like guilt, envy, how they're all formed. And that mood, it says, mood can just happen for no reason whatsoever. You can just wake up in a bad mood for no reason. I love it. Everything else, there's a reason for doing it. You know, something happens, therefore I feel this emotion. Then I have this feeling. But I could be in a bad mood for no reason. It's just how it is. I just think that's amazing how that works. Well, there you are. And so when people are saying, when you're in a bad mood, what is it? What is it? No wonder people could say, well, I don't know, because you don't know. You're just in a bad mood. So I just think that's so funny. But hey ho. Hey ho, that's how we are. Yeah.
Mood is separate to emotion.
So emotion, mood is just, so emotions, feelings and mood are all slightly different. So emotion would be like anger, joy, disgust. So someone will do something, then we'll react in an angry way or a happy way. The feeling that then is attached to it, I feel like this, I feel like that because this happened. But mood is just its own little thing. Yeah.
So you
Yeah.
only classify it as good or bad.
Yeah. It's just, if you wake up with just this, oh, I don't feel okay. The thing that we're then, when people are saying to us, why are you in a bad mood? Why in a bad? What's happened? What's happened? When you say, well, I don't know, the reality is you don't know.
Almost like the stage, like the backdrop of the stage is the mood, and then the actors are the emotions.
Yeah, it's weird, isn't it? It's so weird. Yeah.
Yeah, there much research with like women's cycles and
There's a lot of things with cycles. There's a lot of things coming out with cycles with things like ADHD as well. Because there's so much at the moment with ADHD and neurodiversity, and a lot of them are saying that women's cycles can affect their moods and their emotional regulation. Which we know that anyway, emotional regulation with women's cycles, but with things like ADHD and how a lot of people have been misdiagnosed with other things when it's a natural. Yeah, they had ADHD, but during certain times of the month, it really affects how they deal with it. There's a lot of ADHD stuff at the moment.
With love and compassion, are they moods?
Love is an emotion.
It's
Well,
emotion.
they say that our basic emotions, one of them is joy, but the way that we perceive joy now is not the way that we would have perceived joy as when our brains were forming. So joy when our brains were forming would be, I'm safe, I found somewhere to live, I can. Whereas now, happiness and joy for us is, well, I'm happy because I've got a job that pays my bills. I'm happy because I've got lots of friends and I go out every week. How we equate happiness now is very different to how we would equate it then.
So if someone,
yeah.
So what if someone says like I'm in love? Because that's like a constant. So
but nothing's constant.
Someone doesn't feel love constantly.
Yeah, we will feel love, but love will change.
Right.
So imagine when you first sort of experience love. How do you experience it? Is it the same as you experience it now? No.
I think
it changes, doesn't it?
Same. Love is the same, but the fixation is different. I think.
Yeah, how you experience it is different.
Yeah.
And that's where the thing. One of the things with mindfulness is everything is impermanent. And again, people struggle with that because when we're in a really good place, we want to hold on to it. When we're in a bad place, we want rid of it. We want it to be impermanent. But if you said to someone who's just, said, "Oh my God, I've just met this person. I'm madly in love. It's great," and you went, "Well, that's impermanent feeling. That will change." They'd be like, "I don't want it to change. I want to feel like this forever." But the reality is, we can't, can we?
That's really struggling.
Yeah.
And he would say to me like, well, of course not. We're not in the honeymoon phase forever.
Yeah.
Like, this is real life. And I was like, no, but we should be. Why can't we be?
Yeah, it is about being able to accept that it's impermanent, but that it's meant to not be the same. You're meant to change because you've changed your relationship. Everything changes. We change, we grow, and we change. And one of the things that they say is that we try and hold on to and obsess over what we've got because we're scared of it changing, because we don't want to lose the feeling or what we've attached to it. And it's the attachment to it that we're scared of changing. Like, you don't think you'll lose your love, but you're scared of the feeling you have now going. And the reality is it will change because it has to change. Everything changes. It's meant to change. And one of the things that, when you do look at the Buddhist philosophy of it is, as humans, suffering is, we are all born to suffer. We will all suffer. It's not trying not to suffer. It's having the ability to deal with it when we are suffering.
That also links to the Buddhist conception of emptiness, but that emotions are empty, material is empty because they all change.
Everything's meant to change, isn't it? And that's a lot of people don't like the word suffering now, because I think so quite often people use difficulty, times of difficulty, because I think if you spoke to people about 100 years ago about suffering, they'd probably be more into the suffering. But I think in 2024, if you say to people, well, we're humans, we're meant to suffer, they'd be like, that's a little bit too much to take in. But if you say we'll all have times of difficulty, I think people can absorb that more. We will all have times of difficulty. Yeah, we can take that. And it's not about not having them. It's about what tools have I got to deal with them when they come, because they will come. And again, we struggle with that because none of us want to experience that.
It's like that saying, "This too shall pass." Like everything that you experience, this too shall pass. Good and bad.
Yeah.
It's all gonna pass off.
But we struggle with the good passing.
Yeah.
We want the bad to go, but we want to hold on to the good. And the reality is everything changes and passes, and that's hard sometimes. It's a hard concept to have. Let's talk about pain that you guys work with. So I work with emotional pain. You work with emotional and physical pain, but I wouldn't work a lot with, sometimes health anxiety, physical pain, but mine is mainly emotional pain. And then they were trying to figure out that what models does mindfulness fit in when you're talking about models for pain. And they believe that mindfulness fits in the descending pathway of pain, because it can't fit in the ascending pathway, because if I stand on a pin, the pain comes up from my foot. Where does the mindfulness side come? It's got to come from the brain, because if mindfulness is affecting my brain, it's got to come from the downward side of it.
As in your brain instructing your mind on what you want it, the form that it should take.
Yeah. So when they try to put mindfulness into theories, they put it in the gate control theory. That pain is an experience, and that psychologically and physically it's an experience. And when we have our pain experience, and our brain is then deciding, do I send the placebos down? What do I do? Mindfulness sits in that part of it. In the gate control theory. I love that, because I love that it says it's the bit that it fits in is the substantia gelatinosa, and that sounds like Harry Potter spell, doesn't it?
I remember
It sounds like, doesn't it?
I can't remember the
Substantia gelatinosa. It sounds like Harry Potter. Substantia gelatinosa. So that's where they've put mindfulness in the gate control theory, because they believe that it has to come from the brain. It can't come from the site of the pain, because mindfulness affects the brain, so it has to come from the brain. And because they know that psychological factors can affect whether we feel more or less pain as much as physical, they were like, well, mindfulness has to fit in there. But then they were trying to figure out, well, how does it fit in? If it fits in there, how does it fit in? And like mood affects pain. We know that mood affects pain. All sorts of things affect pain. And then they were looking at the fear avoidance model. Now, well, does mindfulness fit into the fear avoidance model when we're looking at pain? Where does that fit in? And what, with all the research they've had, is that when they're looking at pain and mindfulness and people completing courses and training, it fits in and stops the pain catastrophizing.
Right.
So what they're finding is that you can experience the same amount of pain, but you won't catastrophize about it. So it doesn't necessarily take away the level of pain, but the more that you practice mindfulness, the more that you can not worry as much about the pain. And so it sits in there. And then it's sort of with the fear behaviors, you know, when you're doing the avoidance and all of that kind of thing, it sits there. But then that sort of, people then said, well, is it just a placebo? If it sits in, you know, you don't catastrophize, you're sending down all these opioids, it's just part of the body's opioid system. So it isn't separate, it isn't its own thing. So they've had to do, you know, they've done a lot of research. There was some research done, Zidane and colleagues, so they said, okay, let's see how the placebo system in the body works as far as pain goes. And then we'll see whether that lights up in the same way with mindfulness. So with what they were looking at, so the placebo system with the body, they were looking at the I can never say it, the periaqueductal grey in the midbrain in particular, the thalamus, all of these parts that were essential to the body's automatic placebo system when it's activated. And they found that with less than 10 hours practice, that they could, certain areas of the brain were deactivated and activated, and the periaqueductal grey was actually deactivated, and so was the thalamus. So they're saying, well, if these are essential parts of the body's placebo system, so they have to be activated in order for the opioids to go where they're needed. If mindfulness is deactivating them, what's filling the gap then? No, how is this? You can't say it's a placebo because you're deactivating the two essential parts of the chain. You're taking them out. And they believe that because with the mindfulness training being, it, you know, they reckon it affects at least 8 different areas of the brain, from the midbrain through the limbic system all the way through, and that because our pain experience, we experience it in different parts of the brain, that it's hitting all those parts of the brain. But the problem that they have is because when you're doing mindfulness, you're doing movement, you're doing body scan, you're doing all these things, they can't actually isolate it. And that's where the research is struggling to be accepted, because they can't say, well, when you do body scan, it deactivates that, and therefore it does this, and therefore it does that. They just know that it does it, but they can't prove how it does it. They just think it's a whole process.
I even read that they are actually, well, I think it was on Psychology Today. They actually said that they're trying to get away from a neuroanatomical view of the experience of pain because it's just useless.
Yeah.
Because you can't segment someone's experience. So why would you try and segment?
Yeah.
Why would you try and anatomize someone's experience?
Yeah. I mean, that's what they're saying here. They're saying, you know, there's so much, when we're talking about pain, there's so much. There's, you know, locus of control. Do I feel like I can take control of my experience? How much power do I have? You know, the people that are around me, what influence are they having on me? There's so much psychological that to purely try to anatomize it, it's only giving you half the picture, isn't it?
Yeah.
And what they're saying that even with only 10 hours practice, you can actually affect your brain and turn off the body's own opioid receptors. So they're saying, okay, they've done so with the scans, they said, you know, they can tell that the more experienced we are, the more we light up different parts of our brain. So, and neither of those activate the body's placebo, the brain's placebo area. So mindfulness-based analgesia it modulates the visceral reaction that we have, the prediction side of it. So the more that we practice mindfulness, they're saying that the more we can cope with not predicting the pain happening.
So the more mindful you are of your body.
Yeah. So with novice mindfulness people, what they noticed was that they were actively having to try and put their brain in a place where they could address the present moment. So say I was going to tell you you're going to have a series of tests, and each one I'm going to dip your hand in some really hot water, and it's going to be really, really uncomfortable. Your brain is going to do the whole fear. I'm going to be feeling, I'm going to be feeling really hot water. And with the novice meditators, they would still have that, but then when they had the actual experiment, they could deal with lessening the pain in the experiment. But the more people meditated, the more they didn't have the fear of what was going to happen to them. So they could actually, and they said that with people that have done mindfulness for like thousands of hours, they can have that without even going into a mindful state. It actually takes you to a place where if someone says, oh, we're going to do this experiment, you're going to feel pain, their mind doesn't even go to it doesn't light up at all in any of the fear-based places.
Just like another example, which I thought was really interesting, the SAS do the same thing. So the SAS, they instruct their soldiers to keep coming back to the present moment and to stop thinking about what they've just been through, because they'll then use that to frame the future and to stop anticipating on what the future is. And they tend to find that, like you mentioned, the same level of pain, suffering reduces.
Yeah.
But then I read another paper where they just tried to manipulate suffering. And by manipulating suffering, reducing someone's suffering and anxiety and dread, they also had an effect on the actual level of pain that they were experiencing as well.
Yeah. Yeah, and I think that what they're finding is it's because pain is such it involves all of our brain, doesn't it? But what I found interesting was that they're saying that even with really brief training, you can actually have an effect. So they're talking about they did some studies where they were doing literally brief practice. So they had one paper they did where they only were giving people like 10 minutes at a time. They said, right, you do 10 minutes a day, 3 or 4 times a week. And even then, with that 10 minutes, they still had that effect that it would still activate and deactivate areas of the brain. So it just shows that you don't have to have practiced for years and years and years to have an effect. You just have to be practicing now. And there will be an immediate effect if you practice now. And I think the problem that they're having with getting it accepted is that they just can't say exactly. It takes out these links of the chain, but we don't know how it replaces them and what it replaces them with. It's really interesting to think, isn't it, that you could practice 4 times a day, 20 minutes, and then go and have a medical procedure, and that 4 times over 20 minutes will mean that you won't feel less pain, but you'll feel less worry about it, and you'll feel it will actually help you.
That's similar to it. Quite similar to one.
Yeah, I guess so, because with hypnobirthing, it makes you just focus on your breath and you're working with your body rather than against it. So then I guess you're becoming more mindful of what's going on with your body through breathing.
Yeah.
Rather than feeling the pain.
Yeah. It's that thing, isn't it, where people are learning to say, I am not my pain. And I think when we're in pain, it's very hard to say I'm not my pain. It's very hard to give that distance, isn't it? Yeah.
I've had a few patients recently who have used more mindfulness techniques, and that's been the most effective intervention for them out of everything. Once you've taken care of the strength and the treatment and the mobility, they found out that what really got them that extra 30% was the mindfulness.
Did you ever know that?
So did a visualization where they put their pain on us. The visualization was that they were in a theatre and they were watching their pain and their emotions as characters on the stage, and then with each breath each breath took them further towards the back of the theatre until.
That's an NLP thing, that is.
Oh, okay. Okay.
It's quite an NLP thing.
Right.
It's and also it's a hypnotherapy thing.
Okay.
If you do hypnotherapy, hypnotherapy. There's a hypnotherapy one where you imagine that you're watching everything play out on a theatre screen or a TV screen, and there's variations of it. Sometimes you can have the have it painted out in black and white, and then you or colour, and then you can destroy it. It's it's all variations. Yeah.
Oh, they walked out quacking.
Yeah. Did they walk out thinking they were a chicken?
Yeah.
No, hypnotherapy is good. I mean, hypnotherapy and mindfulness have the same results. They say that the only thing that they will say is different is that hypnotherapy is your someone else is taking control of the result, whereas with mindfulness you're taking control of the result. But when they tried hypnotherapy, sham mindfulness, which is where they'll just maybe say concentrate on your breathing, which is like one element, and it outperformed everything but hypnotherapy. But then I trained as hypnotherapist, weirdly. About 15 years ago, I did the whole training. And hypnotherapy is very much taking people to a safe space, and it's meditating and, getting them in touch with their breathing, getting in touch with themselves. So hypnotherapy is just taking you to more of a suggestive trance-like state. But yeah, it does tend to perform along the same. But yeah, it's an interesting one. But they believe that, the researchers are saying with mindfulness, they think that the pain relief, it's because of the attention, you're allocating your attention to a particular place with mindfulness. They know that it affects the parts of the brain that regulate mood. They know that it affects the senses, the deactivating the thalamus. They know that it makes the amygdala smaller, so the threat smaller. So they know that it works on all of these brain parts. It's just that they don't know exactly what bit of it, and that's where they say it's all of it. It's all of mindfulness that is having the impact.
Yes.
It's everything. You can't isolate it. You've got to take it as a whole thing.
The whole is greater than the sum of its parts.
Yeah, and I think with the medical profession, they try to isolate it and say, well, it must be the breathing. It must be this. It must be that. When actually, when you think, it's like if you're doing the body scan, it's all the spatial awareness. It's everything. You're activating the whole brain, aren't you? And what they find is, the longer that you practice, then you don't anticipate pain in the same way. So a novice practitioner, you could give them 10 hours of practice and they will still anticipate the pain, but then when they actually have the experience, it will affect them. The more you practice, the more you don't anticipate it. So it's really interesting.
The monk that you visited,
yes,
they in their practice do a combination of focus meditation, transcendental meditation, and mindfulness meditation.
They do mindfulness. They only do mindfulness. Because mindfulness in itself is focus. It's focusing your attention. It's your sensations. It's regulating your emotions. It's connecting your mind and your body, and it's connecting your mind and body and keeping your spatial awareness. You're always connected to the earth. So they only do that. And they found that they've actually done research in monks, in Tibetan monks, and they said that the pain intensity does not differ to someone who's a novice meditator, but it's the unpleasantness that reduces. And that's what they're finding, that they don't anticipate the pain. So the more we meditate, the more it's like if we go somewhere that we would anticipate as being painful, the more you can get into a mindful state, the more you won't turn up already feeling it's a threat. It's feeling like it's something that's a problem for you.
One time I've seen in Stoic philosophy, pain is information. It's like the idea that it's just telling you something.
Yeah.
Is that quite similar to what you're trying to get to with mindfulness? That it's just information.
It's like when you're doing a body scan, isn't it? If you do a body scan and you try to scan a bit of your body and your body goes no, or you suddenly feel pain, it's just like, oh, okay, that bit's a bit painful. What's happening here? And pain is the body telling us it's not okay, isn't it? When you think about it.
The pain psychology course that Charlotte and I went on a few months ago, he was saying that what you should encourage your patients to how to view pain is that it's not a bad thing. And that actually is just a warning system. And it's just saying, like, say you sit in a position for too long and your back is like, all the pain is saying is, I don't want to be in this position, can you just move out of the position? So and I try to say that to
Yeah.
just a way of receiving some information
Yeah,
from
yeah.
the body.
Yeah.
Yeah.
And
Yeah.
I think that just trying to help patients realise that actually it's more.
Yeah.
Yeah.
Because there's a really, really rare condition where people don't feel pain, isn't there?
Yeah.
And then they usually don't live a long life because you need pain. We need pain, don't we?
Yeah, they're like, I think it's something stupid. Like,
We
by
need
the time
pain.
they reach teenage, they
Yeah.
have like the spine of a 7-year-old
Yeah.
or something like that, because they don't even
Yeah.
have
And they
the
don't have,
nociceptive reflex, just a shift position when they're sitting.
They don't, and
They
their
don't
blood
get any
pressure doesn't
discomfort
go
at all.
up, and their heart rate doesn't go up. They literally have no response at all.
Yeah.
So they
Leg
can,
sores,
yeah,
things like
they
that,
can literally, yeah,
I feel like as I've got older, I'm
yeah.
And I'm like, ahead of you 3 years that you can't be talking about.
But then that's what they say. Pain is, that's the thing, is that pain is an experience, and it's about
Yeah.
how you experience it.
100%. Because they say, like, with, what's her name? I think Dr. Feldman, I think she's got a book called How Emotions Are Made. She's like, if you were to, and this once again talks about the flaw in using neuroanatomy. She said, if you take an MRI to someone's brain, and 50 people were experiencing excitement and 50 people were experiencing anxiety or fear, you wouldn't be able to tell the difference between them. It's the experience of the emotion.
It's because it comes from the same part of the
amygdala.
Yeah, it comes from the same part of the brain, doesn't it?
Yeah,
Excitement and fear, and it's our brain that then says, "I'm scared."
Yes.
It's that
And
logical,
that's-
isn't it?
and that's
I'm
the
scared. I'm happy. Yeah,
And that's the gap you're talking
Yeah.
about, is the interpretation,
Yeah.
like the descending pathways, how the mind or how the thinking brain interprets the emotional brain is what we have control, or what we have influence over.
And then what they're saying with mindfulness is because it affects the part of the brain that deals with emotional regulation, with attention, where we're putting our attention, all of these pathways, it does have an effect on our pain experience, because it will regulate emotion, and it is working with the old part of the brain. It's not just working with the new part. So it is working with the reactive part of the brain. But what they've also found is that when they put people through these 8 weeks mindfulness-based courses, and found that, they were really effective, but some people won't accept a course unless they think it's specifically designed for what they've got wrong with them. So they had, so a lady, Natalie Morone, did a study because she has found it was really effective, mindfulness-based stress reduction. She had trained under Kabat-Zinn, found it really, really effective for low back pain, and that it, as far as she was concerned, it was really effective. But what they found was a lot of people were dropping out of the mindfulness course, even if they were getting results from the course. And she said it's when she was saying to, well, why aren't you carrying on the course? What's happening? And she said, some of them said, well, you're not taking me seriously because this isn't my mind, it's a physical problem, and you're trying to get me to do mind over matter, and that doesn't work. Why aren't you giving me medication? I need medication because I'm in pain. That they think that mindfulness, they don't understand that it connects the whole brain. They think that it's just like, relaxation or something completely different. And she said that you really have to explain to people exactly what it is and how it works. And what they found in some of the others is that they've actually had to adapt some of the courses specifically for pain, just so that people will accept them. So when you're doing a body scan, you would say, okay, we'll do a body scan, and just being aware of any experience that you have with pain, just being aware of it. With you were doing movement, you would be, stretch, but just noticing the sensation. So you'd actually mention pain. So even though you're doing exactly the same things as in the normal course, because you've said pain, people will accept it. And they've got, in America, they're doing studies in Brown University. They've got a 5-year grant for mindfulness. And they were working on blood pressure. And he did, in 2020, they put people through an MBSR course, 8-week course, and they found, it was effective. People lowered their blood pressure, straightforward MBSR course. After 6 months, still effective. Then people stopped doing it and started dropping out. And they were saying, well, why are you dropping out? And they said, well, you didn't put me through a course for blood pressure. You put me through this mindfulness course. So then they replaced it. So they did 95% was MBSR and 5% they changed just for blood pressure. So the whole course was this tiny little bit where they would say, okay, and with blood pressure, it would be reducing your salt intake or change your diet or increase exercise. So when you're doing your what you want to do next week, what do you want to do more exercise? So that was the only bit they were changing. And what they found was that people stayed on the course and 2 years later are still practicing because to them, it relates to them. Because they changed it. Two years later, people are staying, and they said that they've not changed anything apart from this 5%. And people are saying, "Oh, I've got more self-awareness because I know about my food, I know about," and they're all talking about the 5%. Yes, yeah. So when people say, when they say, well, how does it work? They say, "Oh, well, I understand about my diet. I understand that I have choice over what I eat. I understand I have choice about exercise." And all the people can see is that tiny little bit, when actually 95% of it was exactly what it was before. And they found that with, in America, there's other studies with pain, and they again found people struggle to be receptive if it's just a straightforward mindfulness course. So they had to adapt it again. Again, it would be like you do a body scan, and a normal body scan will just notice if there are any areas that are resistant. You won't specifically say pain, you'll just say any sensations, any resistant, but they would mention pain. And, if it was, again, they were to do with breathing, just notice if there are any areas when you're breathing in your body, anywhere pain. And as soon as people think, oh, pain, I've got pain, they'll buy into it. And it just shows that as humans, so much is psychological, because the course will work whether you adapt it that 5% or not. But people won't stick to the course, even if it's working, because they'll go, yeah, but that course isn't for people with back pain. That's just generic, and I've got back pain. Or that course isn't for people with high blood pressure. So how's it going to work for me? And actually, it's 95% of it's still the same. It's going to work for you. And that's one of the biggest things they have with mindfulness, is that people they just don't understand how it works. So they won't stick to it, even when it's working.
I've had a patient before that came in, and he was convinced he had herniated, and I was like, no tests are showing anything up. And he did have an MRI, but it was years ago. So I tried to explain to him, like, it could be alright now, or you've done this, you've done that, blah, blah, blah. And he just wasn't in it. And I felt like at the beginning I should have just gone, yeah, you got herniated, this is what we're going to do.
Yeah, I just try
Madness, isn't it?
Often I just ride, I try to, if I feel like there's a muscle, okay, then I'll just ride their existing belief system, just tweak it to, so it's a little bit more forgiving for them.
Yeah.
You know what I mean?
It's mad though, how people get it in their head so much.
Yeah.
Just
fully.
Yeah.
When they've made it part of their identity.
Yeah.
And they're probably through their mind, even subconsciously, like, no, man, I've cancelled this many things.
Yeah.
I've not done this many things.
Yeah.
Because I thought I had a disc herniation. And now Eddie's telling me I don't have a disc herniation.
That's all that fear. It's the whole fear avoidance, isn't it? And what they found, with these mindfulness courses, people are like, when they do the questionnaires afterwards, people are saying, "I've learned that I'm not my pain, and I've learned that I can do things." And you just think it is odd how we do identify with so much. It's that when people say, I have anxiety, so I can't do this. I have this, so I can't do that. I have pain, therefore I can't do this. And once we've decided we can't do it, it's a huge thing to have made a decision on, isn't it? Once my identity is I'm a person who lives less of a life because I've got this, it's really hard to get away from being that person.
Especially since people tend to openly defend their decisions anyway, don't they?
And also, I've had people who said, I've lived for 30 years with anxiety. If I realise I can get rid of my anxiety, I've wasted the last 30 years of my life.
Yeah, that's a big thing.
And you're like, well, no, you haven't. You're starting now. But that's huge. It's huge. And that's where the self-acceptance comes in. Accept where you are now. Stop judging yourself. You are where you are now. Live the rest of your life without feeling so much anxiety. Oh, people say, I want to feel no anxiety. Actually, anxiety is normal. We're meant to have anxiety, aren't we? Right. I never want to feel anxiety again. You'll be unique. Good luck with that one. Well done.
That's it.
Yeah.
You're not going to feel anxious when the car's coming your way, man.
Yeah. Yeah.
When they're not broken.
Yeah.
I know.
Fine.
Yeah.
Absolutely fine.
So what they're when we're looking at people that do have PTSD, trauma, that kind of thing, I would say, because most people you've introduced to mindfulness, you'll do an 8-week course, and if you have PTSD, trauma, and if you are dissociating, then, or if you are having flashbacks or something where trying to bring your mind to the attention of the present moment is probably actually going to make what you're feeling worse. Because if you're dissociating, you do not want to be where your mind is at the moment. And if you're having flashbacks, you really don't want to be trying to get someone to draw their attention. Imagine, take your mind back to a past event. They're going to go back to something really traumatic. So if you know that you've got trauma to that an extent, everyone can practice mindfulness, but in that case, you would be doing it probably as part of your therapeutic process with a practitioner, where they call it a window of tolerance. So you've got Dan Siegel invented this window of tolerance idea. So you've got at the bottom, you've got your hyperarousal, which is your dissociation. Like, I'm checking out of this. I don't mentally want to be here. At the other end, you've got complete panic, overwhelm, I can't cope. And some people live in one, some in the other. Some flip between. So you might dissociate, have panic attacks, have flashbacks. You might literally flip from one to the other. And in the middle is this window of tolerance. And for some people, you're talking seconds, when you are in a really bad place. And when you're learning mindfulness, what you are teaching them is find that window of tolerance. It might only be seconds, but it's there. It is there something but you'd be working one-to-one with that. You wouldn't never work with anybody who's openly dissociating or having flashbacks in a group setting, because basically you're probably going to re-traumatize them. And that's, and I think that's and as we know, trauma lives in the body. So if you're doing body scans, you've got to be really careful if you're working with anybody with trauma stored in their body. So, and mindfulness is really, really good for working with trauma, getting people active. It's why somatic work is such a big deal for trauma. Mindful movement, getting people to be active, but moving in a way where they're understanding their movement and what they're doing and how it fits with their body and how it fits with what's happening in the sensations in their body. So I'd say mindfulness has a place everywhere, but if you're looking at someone who's extremely traumatized, you would have to be very careful in incorporating it, probably with whatever kind of therapy they're having. So, some people have thought before when they've been on meditation groups and retreats and things that they're having these amazing experiences, and they've actually dissociated. And they've thought that, oh my God, it was amazing. I've had this amazing experience. I completely lost myself in the whole experience. What I didn't realize was their brain actually checked out. And when you're practicing one way that you would know if you were checking out is you should always be aware of the setting. You should always be aware of where you're sitting, what you're doing, who's around you. You should never get to a place where, unless you go to sleep, obviously, that's different. But if you are in a conscious state, you should never sort of come back. If you come back and you think, I got completely lost, I wasn't in my thoughts, I don't know where I was, I've lost time here, and you weren't asleep, then you've got to say, did I dissociate there for a minute? Was my brain taking me to a protective place? Because mindfulness is never about just taking you out of where you are at the moment. It's about keeping you in where you are, but just allowing you to be in that moment fully. So that's the difference between that and dissociation. So if you ever hear anyone say, I was practicing mindfulness and I completely got lost, they've gone out of a mindful state. You should never get lost. You should always be, going to sleep is completely different. That's when you go into a relaxed state. That's very different to dissociating when your mind's checked out because it doesn't feel safe.
What about, people now they feel like they were I sometimes have that.
If you're practicing like more of a spiritual type of meditation, there are meditations where, because I teach meditation, and sometimes we do a meditation where you tell people to imagine that they've left their body on the ground and they're above their body, but you should still be aware that you're above your body.
Okay.
Yeah, you should still have the awareness that you're above it. Yeah, sometimes we've been like, leave your body there, your physical body, and just take your emotional body out of it. But you should, and it's like you can see your physical body still laying on the beach, but your emotional body can fly above the, it's sort of like you go into a completely different place.
What about if that happens? If like you're trying that, like it happened to me when I was.
Depends what was going on. It might have been. It could have been anything. Depends what was happening. It could have been that you just went into a space. So did you lose time? If you've lost time, it's dissociation. If you didn't lose time, it isn't.
I don't lose time. It's just I felt like I wasn't in my body. I was watching the scene, like in the corner of the room, watching down.
Yeah.
Like Sonny was talking to me, I wasn't replying.
Yeah.
But he said he was looking in my eyes, and it's like I wasn't there for a bit.
Yeah.
I've heard of people doing like transcendental meditation.
Yeah.
They kind of have some experiences.
Out of body experiences.
Yeah.
So a lot of people who are in the spiritual world say, well, you're having a spiritual experience, wouldn't they? But if you were there, and if you knew you were there, that's not dissociating because you were there.
Yeah.
You were just having an out of body experience.
So like blacking out would be more of like a disassociation.
Yeah, it'd be like if you sort of came back from you were in a meditation, you came back and you sort of lost time, and you think, my God, that must have been amazing because I don't even remember that 10 minutes happening. It's gone. I was gone. You don't know where you went. Yeah. People often dissociate when they're not realizing that's what they're doing.
Yeah. David Haywood.
Yeah.
He would when he was starting to become going through psychotic episodes.
Yes.
He would just become aware that he's in a completely different area of London.
Yeah.
Don't know how he got there.
Yeah.
He got himself there on public transport in Camden, blacks out again, he's in Hackney. I have no idea how he got there. Yeah.
It's like you'll just lose time and you don't know where the time went. And it's not that you're unconscious, you've just lost it. Yeah. That's a protective mechanism.
Yeah.
So if you're working with someone that's actively dissociated to that an extent, if you were introducing something like mindfulness, you would be doing it in a very gentle way, and you would be doing it probably more in a physical, keeping them back with their physical body, not in a such a mental way. You'd be like, okay, you're in your physical body, you're on the ground, you're grounded to the floor, that kind of way. You'd be doing it then. Yeah, then you'd be like, and whether it's your breath as an anchor or whatever it is, you'd be doing that. You wouldn't necessarily be trying to get them to do some of the exercises. Which is why I say everybody can do it, but if you are in an extremely traumatic place, be aware that you would probably need to do it in a one-to-one.
Yeah, of course.
Yeah, because otherwise it's too much, isn't it? I mean, imagine what we just did and where that took you.
Yeah.
Imagine where you could go if you were someone that was having flashbacks. If you were dissociating, that could have that 5 minutes could have taken you somewhere really dark, couldn't it? So you have to be aware of where your brain is with these practices. Now, it's not to say don't do it. It's having awareness of where your brain is, isn't it? Because if our brain isn't okay, even 5 minutes can take us somewhere that we shouldn't be. But I mean, majority of us, it's more about us just getting in touch with our brains and the present moment, and the fact that we do catastrophize. We catastrophize with stress, we catastrophize with pain, and being able to say, okay, I'm going to use this practice as a way to actually learn how not to do those processes. So that's what the majority of people are using it for. Yeah. So, did you want to do another practice, or are you done? Do another one. We'll just do this. Is one you can do anytime during the day. This is a 3-minute breathing space. Came, I think, from mindfulness-based cognitive therapy, and it's been adapted ever since. So you can literally do this wherever you are, whatever you're doing. So there's 3 stages. The first one is you're just taking in where you are, what's happening. The second stage is you're bringing it in. It's like an hourglass, top of the hourglass. This is where I am. This is my experience, my full experience. Bringing it into my breath, then bringing it back to my experience again. Hiya. Yeah. You're right. Yeah. You do look like that's all right. Don't worry. Don't worry. It's all meant to be done. That's all right.
Thank you.
Very, exactly the same as the video.
So, and yeah, and I mean, any practice you do is meant to be done in this kind of environment. You can do it no matter what the background noise is, no matter who's around you. You can literally take 3 minutes out and just check in for yourself. So okay, we'll start now. So just notice your posture, just sitting up, just ask yourself, what is my experience right now? What am I experiencing in my body, in my mind? If there's anything uncomfortable, is it allowing you to go there? If not, then that's absolutely fine. If there's anything pushing you away, just notice what's pushing me away, what's drawing me to it, where am I? And then now just try and notice your breath. That's okay. Notice your breath. Just notice how you're breathing. You might want to put your hands on your body to just really anchor your breathing in. You might want to count your breathing just to bring it in. Just notice your breathing, but don't focus on it to the point where you can't focus on anything else. It's about just noticing. If you can notice your breathing, but always keeping the awareness of where you are. Feet on the ground, body on the chair. Seeing if your mind will just let you notice your breathing and move away from all of your experience. And then just coming back to your whole experience. Noticing your whole experience again, where you are, how you're feeling, what sensations you've got. Are they exactly the same? Was there any change? And if your body and mind will allow you just to say, this is all okay at the moment, how I am feeling is okay. It may not accept you saying that. It might do. If it does, just say it. It might tell you something else. Just listen to what it's telling you. And that's that. Literally, what, 3 minutes? What were your minds telling you? And you can do them anywhere. You just literally, at any moment, you just go, where am I?
Mine was quite calm. It's just felt like just things coming in and
Yeah.
out of my conscious field, and then that was it really. It was nice. Nice just to observe, like you'd observe clouds.
Yeah.
Yeah.
Yeah. And you can do that anywhere. You just go, okay, what's happening? Just take it back to the breathing.
Yeah, it's good not to think of other things.
Yeah.
Mm-hmm.
Yes. And that's, yeah. But I think it's all very well having a formal practice, and it's lovely to be able to have a formal practice, but the reality of life is sometimes life goes wrong when you're out and about living life. You know, it's sometimes when people are at home, that's their safe space. So they'll find it much easier to practice things at home. But it's when you're out in the real world, you need something that can bring you back. It's that, I need something for 5 minutes. I need a 3-minute thing. I just need something. And the idea is things like mindfulness is you can do it with your eyes open. You don't have to just do all of this. You just go, okay, where am I? I'm checking in. What's happening? And you can do that if you're triggered by anything. If something triggers you, you say, okay, checking in, bring it back to the breathing, noticing where I am, feet on the ground, where am I? I'm okay. And if something in your brain goes, you're not okay, just go, okay, my brain's a little bit not receptive of that one at the moment. And just notice.
I try and do it when I'm walking to work.
Yeah.
Because I feel like that's a good.
Yeah.
I do it when I'm treating patients, when I'm talking to patients as well. So like for example, just really looking at them and like really looking at their face, really looking at, really feeling what they're coming in with, but just really trying to lock into that present moment. I find that, and the day goes so much quicker as well. When I'm having a more mindful day, the day.
And do you know what they say that we very rarely, it's like the professions, where we are, like counselling, like your job, that where you're actually really focused on people. People don't want the attention, but quite often we feel like we're not given the attention, are we? Like we'll go to the doctor and we'll get 10 minutes, and then it's next. And when we're somewhere where someone's actually really focusing on us, what is it about you? What's happening? What is your experience? That can help with our healing anyway, can't it? Because we're being seen. We're being seen. It goes back to being seen, doesn't it?
I'm seeing ourselves as well.
Yeah.
Like when other people see us, it helps us to see ourselves.
Exactly. Yeah. Especially when we're not feeling okay.
Absolutely.
Yeah. Just to be seen by somebody else is such an important thing.
I feel like we're going to need round 2 soon, Trish.
I
feel like there's more.
There's always more. We haven't. I kept the practices very short because they're things you can just do. Because I think formal practice is lovely, and you've got a child. You're not going to be able to go home and do an hour at home.
I did so much like formal practice before I had more. I loved it. But I feel like doing that has really helped me. Since then, because I don't have time to do it now. Like consciously, since she's been born, I've probably
But then if you do the short practices throughout the day,
like I used to do
that's enough, isn't it? And what your brain's getting out of it is as beneficial. Because like they say, people who've done 10 hours, novices who've done 10 hours have still got the ability to help alleviate their pain. So if you've got that, and that's from novice, think of what you're doing and you've already got that.
Trish, for the camera, if someone wants to get in contact with you regarding mindfulness, what can they do? Where can they find you?
They can contact Revitalize Clinic and ask to speak to me. And you can, mindfulness is for everybody, as I've said, or you can do one-to-ones, incorporating it with other therapies.
Thank you, Trish.
That's all right. So that's